Good evening and welcome to MSAT for August 2018. I'm Cam Crittenden, Division Manager of Trauma and Critical Care at the Virginia Office of EMS. Beginning in September of 2018, the new consolidated testing site, CTS Scenarios for EMTs, will now have capnography, pulse oximetry, and glucometry values available as part of the patient's assessment findings. These additional vital signs will help the candidate evaluate the patient's status and should be used by evaluators to help confirm the candidate's differential diagnosis and if the correct treatments are being performed. This month on MSAT, we feature Dr. Jeff Ferguson, who will present 3 real-world scenarios that any EMS provider can expect to encounter in their practice. Pay close attention. He will be asking us some challenging questions at the end.
Hi, my name is Jeff Ferguson. I'm an emergency physician at VCU Health and an EMS medical director. Prior to becoming a physician, I was a volunteer EMS provider. I remain a nationally registered paramedic, and I'm still actively involved in pre-hospital care. Today we will be taking a look at some real-world scenarios for calls for respiratory distress. At the end of each segment, we will review the case using some questions regarding the scenario and then discuss the answers. The first scenario features Chesterfield County Fire and EMS. Back up in front. Chesterfield Core View is patient contact.
Hey sir, how you doing today? My name's Jason, what's yours? John, what's going on today?
I can't breathe.
Okay, you can't breathe. When did this start?
A little bit, just a few minutes ago.
What's that?
A little while ago.
Just a little while ago? Okay, how long's a little while ago?
Maybe 15.
Okay, 15 minutes ago. What's your last name, sir?
Michaels.
Mr. Michaels, has this ever happened to you before? No? Okay. You want to get a set of vitals, and Justin's listening to the lung sounds. Mr. Michaels, are you having any chest pain right now? Do you have any nausea or vomiting? Okay, have you been sick at all recently? No?
We got bilateral wheezing.
Bilateral wheezing, okay. If you want to go ahead and get a breathing treatment set up, 5 of albuterol, 0.5 of ibupropium.
Would you like to put him on 10 salts?
Not yet.
Okay.
Sir, have you ever had a breathing treatment before?
No.
Okay, are you allergic to any medications?
No.
No. How old are you?
52.
52. And what's your birthday?
18.
Blood pressure is 151 over 92. Pulse is 111. 88% room air.
Okay. Mr. Michaels, we're going to put you on some oxygen and get you some medications into your lungs, okay? And then we're going to get you on the stretcher and get you into the hospital. Is there anybody here with you? Okay, she's inside, and she knows that we're here. Is that right? Okay. Have you been sick recently at all? Running a fever? Okay. Are you diabetic? Never had a heart attack before, right? Have you ever had a stroke? Do you have high blood pressure? How about a list of medications? Okay. Can I reach in your pocket and get it out for you? Okay. Tell you what, if you can get that for me. Hey Justin, so if you want to get the stretcher ready, and as soon as we get him on this breathing treatment, we're going to get him into the ambulance. Okay. Have you ever had a blood clot before? No? Okay.
Sit on front of your face.
You breathe the treatment.
Okay. And no allergies to any medications? Okay, sir, just to recap, about 15 minutes ago you started with some shortness of breath. It's been getting worse. You do have a history of COPD and no other complaints right now. Is that correct? Okay. All right, we're going to get you onto the stretcher. Jay, let's go ahead and move the stretcher around. What'd you get for a respiratory rate?
It's at 30.
Okay. All right. Let's help him up and we'll get him on the stretcher. I got this, Justin.
Okay. Try to scoot up all the way up to here for me, okay? Get up and get your feet
All right, let's buckle him up.
underneath your arm.
Come on under your arm, sir. Good. All right, Justin, when we get into the back, put him on a 12 lead.
Okay.
Jay, if you want to do in-tidal capnography and start an IV on him. I got that. Is that breathing treatment helping you at all, sir? Just a little bit? Okay. All right, guys, we're locked. You want to go ahead and put him on the monitor? Justin, put him on in-tidal
Take these
capnography.
straps off your chest, all right? I'm going to put a few stickers on your chest. I'm going to take a picture with your heart.
Jay, can I borrow your stethoscope? I'm going to listen to his lungs one more time. Deep breath, sir. Deep breath. Good. Deep breath. Deep breath. All right. All right, guys, just to recap, he's got moderate respiratory distress. We've got him on a breathing treatment, 5 milligrams of albuterol, 0.5 of ibupropium. His blood pressure is elevated and his O2 sats are low. They're not coming up very much with the oxygen. We're going to go ahead and check on his heart, do a 12-lead EKG, and we're going to check in-tidal CO2 to see if he's retaining CO2, as we would expect him to with COPD. Sir, is that making you feel any better at all?
Yeah.
Okay, just a little bit?
A little bit more.
Okay. All right, so he's sinus tach on the monitor at 144 beats a minute. Sir, have you ever been intubated before for your COPD? A tube put down your throat? Okay. All right, so we've got him on capnography. He's got shark fin waveform at 57, so he's retaining some CO2. Let's go ahead and do that 12 lead. Hey, can we get a blood glucose real quick? Are you getting tired, sir? Okay. Have you ever been put on CPAP before? Okay, ever had a mask blown in your face? Okay, so this is what we're going to do. As soon as we get you on this heart monitor, we're going to put you on CPAP, okay? It's going to feel uncomfortable. It's going to be air blowing in your face, but it's going to help keep your lungs open and help get more oxygen into your lungs, okay? All right, so Justin, once you get that 12 lead done, let's go ahead and get CPAP out.
Okay. Finish this, I'll get CPAP out.
Okay.
What happened?
prick your finger to check your sugar, okay?
Yeah.
What's the 12 lead saying there, Justin?
Sinus pack, no ectopy, no elevation.
Okay.
1, 2, 3.
All right, so we've got no signs of a STEMI on the 12 lead. All right. Justin, as soon as we get him on CPAP, Jay, you're going to get up front and we're going to start headed to the hospital, okay?
All right, so we're going to take that mask off and put this mask on, okay? This one's going to blow a lot of air at your face. It'll be a little uncomfortable. It's going to help you breathe, okay?
Okay.
Sugar's 110. Okay, sugar's 110. Sir, when's the last time you ate? Okay, open your eyes and look at me. Okay, he's still able to follow commands, but he's starting to get tired. What did you say you were doing leading up to this?
Working in the car or the garage.
Working in the garage? Okay, you had the garage door open, is that right?
Yeah.
Okay, good. All right, sir, I'm going to take this off really quick, okay? Take this mask on your face. Now, this is going to be uncomfortable, okay? So you're going to have to work with me. What I want you to work on is your breathing, okay? Deep breaths in through your nose, out through your mouth. Hold on 1 second. Stop. Yeah.
There we go.
Okay, go ahead. You got this one? All right, let's make sure we get it good and snug on his face. I'm going to go ahead and pop inline nebulizer treatment with this. Okay.
You ready for transport?
Yep, let's go. What hospital do you want to go to? St. Mary's. Okay, St. Mary's. Priority 1. Is that helping at all, sir? What's that? Your nose is plugged up? Okay. Deep breaths in through your mouth, okay? I want you to work on your breathing, okay? All right, can you hand me the cell phone? I'll go ahead and call the hospital.
Do we have an IV?
Yeah, if you want to go ahead and start an IV, that'd be great. You got a
Thank you.
IV set up over there?
Let me get this arm.
Hey, St. Mary's Hospital, this is Chesco Medic 20. Got a patient care report? Okay, got a 52-year-old male. He's coming from home. He said about 15 minutes before we arrived, he was working in his garage, had a sudden onset of difficulty breathing. He does have a history of COPD, and he does have bilateral wheezing throughout all lung fields. Right now, blood pressure is 150, 1/92. Pulse is 134 and regular on the monitor. He's sinus rhythm on the monitor. Sinus tach on the monitor with no signs of a STEMI on the 12 lead. O2 sats initially were 88% on room air. He's up to 95% on room air. On a CPAP with a nebulizer treatment. GCS is 15. Blood glucose is 110. And right now we're getting ready to start an IV on him, and we're going to try to coach him on his breathing and see if we can get his respiratory rate down. And we should be there in about 10 to 15 minutes.
All right, hold still, a little stick. Ready?
Okay,
1,
thanks, bye.
2, 3.
All right, sir, how are you feeling now? Any better? Okay, you look like you're feeling a little bit better. I'm going to go ahead and listen to your lung sounds again, okay? All right, Justin, so it looks like you still got shark fin waveform on the capnography, but his end tidal is coming down, so I think our treatment is starting to work a little bit.
Okay.
Deep breath.
All right.
Deep breath again.
Got 40 gauge IV in the right.
Deep breath again.
The next scenario features life care medical transport.
Medic 10 Life Care. We are on scene. Alright, and put it down a little bit. Thank you. See, buddy?
My son, he can't breathe.
Okay, where is he?
He's back in here.
Alrighty. Hello?
Hard time catching my breath.
Yeah? Okay, well, my name's Laura. It's my partner, Stephanie.
How are you doing?
We're going to see what we can do for you.
Tom,
Alright. There's going to be a lot of things going on. Can you tell me what happened?
I'm just having a hard time breathing.
Yeah? I'm sure I'm here for me, hon. Alright, so what's been going on? How long's this?
Just a couple days.
Couple days?
Yeah, it's
Okay.
gotten worse.
Since when did it get worse?
Can I see your finger, Tom?
A couple hours.
Okay. Alright. You been to the doctor or anything?
Yeah, yes.
CO2 is at 80.
Yesterday.
Okay. Can you go ahead and get him on some oxygen, please? Alright, is it okay if I listen to you? Okay. You can just breathe normally.
I'm going to put the Capno on him.
Is it okay if I unbutton a little bit so I get down here?
Okay, Tom. This is kind of just a little device that goes right on your face. It's going to go slide in your nose.
Have you been in any pain at all?
No pain.
A lot going on. Do you have any medication allergies?
No.
Do you have any other allergies? Okay, get right back here. So a little bit of a shark thing going on here.
I'm going to put him on a normal breather.
Yes, please. Respiration's kind of high. Have you ever had a breathing treatment?
At the doctor.
Yeah? All right. And you have no medication allergies, correct?
No.
Okay, we're probably going to get that going here in a few
Just
minutes.
slide him over your face.
There we go. When you get done with that, can you start the upper lead, please? Yes. All right. Have you had any chest pain, tightness,
Just soreness.
sore?
Yeah.
And when does that happen?
I'm coughing.
Okay. What's it look like when you cough? Do you have anything
Green.
up? Green? Okay. All right. How long have you been on your medications for that?
2 days.
All right. Do you know what those are? No? Okay. Mom, do you know what his medications are?
Let me get them.
Okay, thank you. All right. Do you have any other medical history? Asthma, COPD?
No.
No. Anything cardiac, heart failure,
No.
arrhythmias, anything like that?
Okay, Tom. Is it okay if I put this on your left leg?
Yeah, go ahead.
And here's his inhaler.
Thank you, ma'am. Alrighty. So you have had albuterol. Have you had any reactions to anything like that?
No.
Okay. All right. We're going to get a neck treatment to help open up your lungs a little bit.
And Tom's going to go on your left arm. And this one's going to go on
Is
your
that
right.
helping you breathe at all yet? A
Um,
little bit better.
maybe a little bit.
All right. Let's see.
And that's 92.
Alrighty.
Get a blood pressure.
Yes, please.
Check our mouth.
Alright. 92.
What is that?
This is albuterol. It's like the breathing treatment you had at the doctor's, and it's the same type of medication that you have in your inhaler.
Okay.
Okay?
133/91.
Okay, good. All right, we're going to start with this. We have some other tricks up our sleeve. All right, let me take this off for you.
And check his glucose.
Yes, please. I'm gonna switch this one. You doing all right?
All right, Tom, is it okay if I poke your finger over real quick, check your glucose?
There we go. Just breathe normally, okay?
And Tom, I'm going to check your glucose.
Looks like his oxygen's up to 92.
Give a little poke.
That's heading the right way. How you feeling?
A little better.
Glucose 96.
Awesome. When's the last time you ate?
I had breakfast this morning.
Okay. All right. Good. Just take a little bit to breathe there. While she's getting that started, oh, we're good. You been running a fever at all?
I don't think so.
Okay. Let's double check. Is it going to touch you? It's just it's infrared, okay? All right. No fever. 98.1. Thank you. Okay. Your oxygen's going up. That's a good sign. I'm going to listen to you a little bit, see how this is helping out. Of course, you're going to rattle at me.
Are you going to want to start 90?
Yes, please. You had IVs before?
I don't like them.
I don't think a lot of people do.
Yeah.
It kind of hurt. Hopefully it'll help you feel a little better.
Alright. Sound a little looser in there. That's good. That's good. Alrighty. Alright. Do you care which arm we start? Do you have any particular...
Make it fast.
Fast? Okay. Take hold of my arm. Got a bag spike for me? Awesome. Just tap it on there. There you go.
How are you feeling?
It is helping.
Good.
As soon as that's done, I think we can go back to just the nasal and see how he does on that.
Okay.
It's going to be tight, okay? If you like your arm, though. Oh, yes.
I'm going to hook your nasal back up. Hook them on 2.
Yes, we could start with 2 and see how that's going. Alright. Good. Alright. It's a little bit cold here. Ready?
Over
Alright.
in just a second.
1,
We're gonna get you to the
2.
hospital. Gonna get you feeling a lot better. It's gonna be good. How's your chest feeling?
A little better.
Yeah, good. That's better. It's better than when we got here. Glad to hear it.
You're good. All done. I'll get this going, and we're gonna get you out to the truck and head you to the hospital. I think that's probably gonna be the best thing to do at this point. Okay?
Okay.
Alrighty. Alright. Do you feel like you can walk with assistance, or do you want us to bring the stretcher in and take you out like that?
You walk slow.
Are you sure?
Yeah.
Okay, we'll be right with you, all right? shirt secured. All right. Couple bumps coming up, all right? 2, 3. All right. Okay. How you feeling right now?
Feeling a lot better.
Good, good, good. All right. Everything's looking good.
Alright, I'm gonna move your blood pressure cuff so I can move the monitor, okay? Hup. So your blood.
I'm sorry. Alrighty. 96. Alright, let me get you situated here. We can get going. Alright, good. Alright, I'm going to move your oxygen over, so you're going to feel it turn off for just a minute, but we're hooking you right back up, okay?
You doing okay?
Alright. Thanks, ma'am.
You need anything?
No, ma'am. I think we're ready. You let me know when we're about 10 minutes out, please. Thank you. See? I have as many racing straps as you do. All right. Yes, ma'am. All right, let's see. I'll find my hospital here. Are you in any pain right now?
Okay.
Doing good?
Yeah.
All right, good. Yes, this is Laura with Medic 10 Life Care. We're en route to your facility. ETA approximately 10 minutes. I have a 30-year-old male. Chief complaint, difficulty breathing. He was diagnosed with pneumonia 2 days ago at his physician's office. He woke up this morning with increasing shortness of breath. When we first got there, his stats were at 88. We put him on a non-rebreather with improvement to 92. His lungs were coarse throughout. Just did an albuterol treatment with improvement again to 96. Changed to a nasal cannula on capnography. And his current vitals are as follows. 133/91. He has sinus tach on the monitor at 130. Respirations have decreased from 26 to 17. He is at 96 on 2 liters. He has a 20 gauge in his right AC, running normal saline, KVO. His end-tidal has increased from 38 to 40, and his last glucose was 96. Do you require any further? Okay, thank you.
Our last scenario features Henrico County Division of Fire.
long as you do with those 2 bags. Fire department. Oh, we're in here. Alright. Let's see, some pretty obvious distress here. Sir, what's your name? Kevin. Okay, Kevin, you just focus on breathing. My name is Rob. Thank you, sir. I'm gonna listen to your lungs. We'll get you some medicine, okay, buddy?
We'll get you some room air sets. Bartender, sir.
Some pretty heavy expiratory wheezes and rather diminished bilaterally there. Just listen to your
Room air
lungs.
sets,
Okay,
85%.
buddy? Alright. So
Cannula side stream.
we'll do a side stream cannula and a non-rebreather for actual oxygen therapy. Okay. Kevin, we're going to put a couple different things on you here. This is actually going to help us measure how you're breathing. And then we're going to give you a separate mask here in a second to give you some oxygen to help your breathing, okay? It's on your ears. Okay. We got air coming, okay, buddy? Tell you what, I'll take that if you want to throw a BP cuff on so we can finish getting the rest of our vitals here. Okay. There you go, buddy.
Alright.
So 48 on the end tidal,
Yep. 87.
still 87 on the SAT, working on pressure 148 over 91. Kevin, I'm going to ask a couple questions. How long ago did this start? About an hour ago? And do you have a history of breathing problems? Asthma, okay. Do you have an inhaler?
I ran out.
You ran out, okay, so we'll do a duo net. That's very appropriate. Kevin, what were you doing when all of this started?
Cookie.
Cooking? Okay. The stove is off now, right? Okay. And we'll double check that in a second. But you got exposed to a little smoke, I take it? Okay. We'll try to breathe that oxygen in nice and deep. We're going to get you a nebulizer here in just a second, okay? And while you're working on that, we'll go ahead and get a 3 lead started. Got that nebulizer almost ready for you, okay? Kevin, while we're working on that, do you have any allergies that you know of? No allergies at all, okay. Then we're going to trade you out, okay, buddy? I'm going to take this, give you this. It's going to be kind of weird working around this nose piece here, but we're going to hold that as upright as we can. As much as you can, try to breathe this medicine in as good and deep as you can. If you can get it in as good and deep, it's going to help you out even better, okay? Yeah, that's great. Thank you. I'm going to go ahead and give this one another listen. There you go. Try to breathe that medicine in good and deep.
Looks like we're at the science patch. We're at 130, 140.
Okay. It's still very wheezy, but already doesn't seem quite as diminished.
So his rate's still 30 respiratory.
Okay.
You lower stretcher down.
Okay, you still got some pretty good wheezes, but pretty good wheezes still, but already the bases aren't quite as diminished. Good. You're doing good breathing that medicine in. Some of your numbers are already looking better, so that's a good sign. While we're working with this, I know you've been having a hard time breathing. Do you have any pain? Okay. Did that start before or after you had a hard time breathing? Started after? Okay. Good. And Kevin, I know you said you've got a history of asthma, which is why you had the inhaler, but the inhaler's just out. Have you ever had breathing problems so bad you had to put a breathing tube down your mouth or anything? Nothing that severe? Okay, good. Good. Well, Kevin, your vitals are improving. I think you're responding good to the medicine, but still, you had a pretty bad asthma attack, and I think it's worth going ahead and taking a ride over to the hospital and getting checked out. Doctor's Perham is going to be the closest hospital from here. Does that work for you? Okay. You sound a lot better already. You're not audibly wheezing like you were when you first walked in the room. Good. There you go. Breathe that medicine in good and deep. Okay. Well, we'll start getting our stuff straight, and I think here in just a second, we're going to be ready to get Kevin for a ride over to Dr. Perham. Kevin, how does your breathing feel? Still tight? Okay. We're just going to keep working on the medicine, alright? Alright, we're good. His pulse ox is up to 92, end tidal 41, and his rate's down to 23. It's like we're trending in the right direction, Kevin, so I think that medicine is doing the trick for you. So we're going to go ahead and start moving towards the ambulance so we can head to the hospital, okay? Now, Kevin, certainly at any time as we're moving, if anything begins to change, if you begin to feel worse, and certainly if you begin to have pain or feel dizzy or anything of that sort, you let us know, okay? All right. So we've got several wires on you, and we're going to help manage those. So let's just start small. Let's just start by standing and see how you feel. How's that? Good? Okay. Take your time. Alright, Kevin, just a couple of bumps loading into the ambulance here. Alright. So Kevin, the commotion you're going to hear is us just kind of switching some things around here. I'm going to get you off of this portable oxygen and put you on the onboard. I see that you're just about out of this medication. How does your breathing feel now compared to a while ago?
A little better.
So a little better? Okay. So your heart rate's about 130. Now that's normal to be up a little bit because of the medication. That's normal. But your oxygen saturation's up to 96. Good. Your end-tidal CO2 is down to 42. So I think we're trending in the right direction. So Buzz, when we DC this, instead of the non-rebreather, we'll go ahead and switch over just to the cannula. Good. Yeah. Yeah. 2. We'll do 2. Yeah. And I'm while you do that, take a little peek here. All right, Kevin, just listening to your lungs again, okay? Just give me a couple more of those good deep breaths. Oh yeah. Good. And again. Good. Okay, so those bases have definitely opened up. Good. Sit up for just a second, bud. Okay. Good. Okay. All right. Now, still a little bit of wheezing, but those bases have, they're not nearly as diminished as they were a while ago. So I'm very happy with how we're looking. I'll tell you what, we'll go ahead and start heading to Doctor's Param, a nice easy code 2. Now, Kevin, obviously, if anything changes at any point in time, I want you to let me know. But now that you can breathe a little bit better, I just want to ask you a couple of questions. So I know your name is Kevin. How old are you?
25.
25. Okay. And so we talked earlier, you have that history of asthma. You have an inhaler for it, but the inhaler was empty. Any other medical history? No heart problems? Anything else? Any recent illness or injury? Okay. And when was the last time you ate or drank anything?
This morning.
Okay. And you've been eating and drinking as usual, using the restroom as usual. None of that's out of sorts. Okay. And before we get ready to move here, I'm just going to make sure that I got all of my stuff secure in the ambulance. And we're going to make sure we got you secure. There we go. Just make sure we got you buckled in for this ride here. Just 2 more seconds, Buzz. Sorry, Kevin. Okay, all that's good and comfortable and everything? Good and comfortable, ready to go? All right, good deal. Okay, Buzz. Yep, ready when you are. Good afternoon, Doctor's Param. This is Rob on Henrico Fire Medic 11 with a patient care report. Yes, ma'am. We're about 10 minutes out with a 25-year-old male. Chief complaint, difficulty breathing. Onset of symptoms was about an hour ago. The patient was cooking, burned some food on the stove, made some smoke, triggered what we're suspecting was an asthma attack. The patient does have a history of asthma, as well as having a prescription for a metered dose inhaler, but unfortunately his inhaler was empty. So we had to call 911. Initially, the patient presented a little bit of tripoding, heavy wheezes bilaterally, especially expiratory wheezes, and some very diminished lung sounds in the bases. At that time, it was a heart rate of about 130 with an O2 saturation in the 80s and an end-tidal CO2 of 47. We've done one round of a duo neb, and now we have much better lung sounds. We still have some wheezes bilaterally, but the bases are no longer diminished. Heart rate is 131 with a nice sinus tach on the 3 lead. Also, his O2 saturation is 96%, and now that's on 2 liters by cannula. And his end-tidal CO2 is down to 42. No other complaints at this time. Resting comfortably, and like I said, we'll be there in about 10 minutes. You need anything else? Okay, thank you much. Okay, so all that is calling the hospital, let them know we're coming with you so they can get ready for you, okay? How's that breathing feeling? Good, 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 good. All right, excellent, yeah. Like I said, your heart's still doing exactly what it should be doing. Your blood oxygen saturation, or how much oxygen is in your blood, that's staying up. It's 96. And the amount of CO2 that you're breathing off, which is just something else that we can use to tell us how good you're breathing, that number's 42. So that's a much better number of what we're looking for compared to a while ago, okay? But, what I'm going to do now is call the hospital and let them know that we're coming, okay? Good afternoon, Doctors Parham. This is Rob on Henrico Fire Medic 11 with a patient care report. Yes, ma'am. We're about 10 minutes out with a 25-year-old male. Chief complaint, difficulty breathing. Onset of symptoms was about an hour ago. The patient was cooking, burned some food on the stove, made some smoke, triggered what we're suspecting was an asthma attack. The patient does have a history of asthma, as well as having a prescription for a metered dose inhaler, but unfortunately his inhaler was empty, so we had to call 911. Initially the patient presented a little bit of tripoding, heavy wheezes bilaterally, especially expiratory wheezes, and some very diminished lung sounds in the bases. At that time it was a heart rate of about 130 with an O2 saturation in the 80s and an end-tidal CO2 of 47. We've done one round of a duo neb, and now we have much better lung sounds. We still have some wheezes bilaterally, but the bases are no longer diminished. Heart rate is 131 with a nice sinus tach on the 3 lead. Also his O2 saturation is 96%, and now that's on 2 liters by cannula, and his end-tidal CO2 is down to 42. No other complaints at this time. Resting comfortably, and like I said, we'll be there in about 10 minutes. You need anything else? Okay, thank you much. Okay, so all that is calling the hospital, let them know we're coming with you so they can get ready for you, okay? How's that breathing feeling? Good, 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 good. All right, excellent, yeah. Like I said, your heart's still doing exactly what it should be doing. Your blood oxygen saturation, or how much oxygen is in your blood, that's staying up. It's 96, and the amount of CO2 that you're breathing off, which is just something else that we can use to tell us how good you're breathing, that number's 42. So that's a much better number of what we're looking for compared to a while ago, okay? So we're going to try to give you a comfortable ride the rest of the way to the hospital, okay?
We would like to thank Chesterfield County Fire and EMS, Life Care Medical Transport, and Henrico County Division of Fire for their participation in this MSAT, and thank you for your participation as well. Hopefully this was helpful to you.